In chemistry, we define a substance as any pure element or compound. And in biochemistry, there is a course which is referred to as xenobiochemistry. That is how the bodies of organisms metabolize chemicals and substances within the body. Xeno refers to any substance that is not produced in our body, that's introduced into our body system from outside the body itself. And I would like you to know that our bodies are made up of chemicals, majorly. So when you talk about metabolism, talk about catabolism and anabolism. That is how the body make up bigger molecules from smaller ones within the body. That's anabolism. And catabolism is how the body system breaks down the big molecules into smaller ones, all for the purpose of use by the body. The operations of your body system, of our body system, is pure chemistry. So you need, with that one at the back of your mind, you need to be very careful of the kind of substances that you're allowed to enter your body henceforth. Because all these interact with different substances already within the body. Our bodies are made up of, what we call macromolecules. The muscles are glycoproteins. The flesh, as you know, they are majorly proteinous in nature, and our blood is made up of chemicals. And you know already that 70% of your body system, of our body system, is water, which is H2O. And to make our nervous system works very well, we need micro elements. You hear about sodium, potassium, and so on. And our bones are made up of calcium, phosphorus, sulfur. So you can see our bodies are made up of chemicals. And the drugs that we use, the medications, are chemicals. So you can see when you bring them into the body, they help the body to function better. I'm giving you this as a background so that when we now go to the main topic for the discussion, substance use prevention, you'll be able to appreciate it better. You don't just take any substance you use into your body. That is why you are advised, seriously advised, and we are presenting that one in this reflection time. Substances that have been tested to a good extent or a reasonable extent that you can take into your body for some imbalances in your body system. They call that one, those ones, off-the-counter drugs. Even that one, you have to use them according to the dosage prescribed on the instructional manual in the package, or according to the advice of the pharmacist you meet at the pharmacy. And you are seriously advised not just to go to any chemist near you and just take some drugs and say you want to use. You may be damaging your system instead of helping your system to recover. You cannot be robbing Peter to pay Paul. That means you want to treat a headache or treat one ailment, just go to a chemist, they just give you some drugs and you take it. That may become symptomatic treatment. That one may seem to subside, but more damages may be done within your body system. So we'll be focusing on substance use prevention. And parents have this challenge. When do you start to talk to your child about substance use? The system has become so bad that apart from the manufactured substances, which we buy in form of tablets and capsules and syrups, there are many that people are now taking from the environment, and they are using them one way or the other, and it's seriously damaging their system. So this is a clarion call for everyone within our society, both the adults, our aged ones, our youths, and our teenagers, and every child. So share this and let them know. Don't just take any substance into your body. As bad and as simple as the glue is or the gum, people now use that one and abuse it for whatever reason, and a lot of other substances like that. So there's one song by Dandy Livingstone. It says, before you make your move, my friend, check out yourself. Before you make that move, my friend, check out yourself. The going may be easy, but the coming back be very tough. Watch out, you don't get stuck. Before you make that move, before you touch that substance, before you say you want to taste or try that substance, check out yourself. Getting away from the effects may be impossible. Some people it's zero. Some people it is life sentence. Some people, because when you take these things, especially the ones that work directly with the nervous system, it can destroy the nervous system. And when you destroy the nervous, that is it has broken down the operational system of the brain and of the mind. And once the mind is destroyed, you are no more a human being. Because you cannot be in control again of your faculties, of your reasoning, of your activities. Then, and what makes you and I to be different from other animals is because of the availability of our thinking faculty. We can do critical thinking, critical analysis, and so on. You can make reasonable decisions by yourself by considering available facts. But once you allow your mind to be construed, to be damaged by any of these substances, I won't be mentioning their names now, then you are not in control of the mind again. Then you are less than a human being. You can't think by yourself. Then you just become something. And I believe you don't want to be that, and you don't want any of your children to be that. You don't want any of your relations to be that. You want to be a complete normal human being in charge of your faculty, of your reasoning system, and being able to do and achieve something to be of use and of value to yourself, to your family, and to your community and society at large. You don't want to be called a thing. You want to be called a human being. But once you start to use substances, then you have lost you might lose your personality altogether and you become a thing, not a being again. Then you become a living dead. You might have seen the videos of some of these patients in court. So please, this is a clarion call. Don't trouble when trouble does not trouble you. Don't allow anything or anybody to push you to try it, not even once. That once may be the very first and last time you will ever be in charge of a faculty and reasoning system. Run from it. Literally run. Say no. Do everything you can to avoid it. That very first time may be an irreversible. There's something called irreversible reaction in chemistry. When the reactants go to form the products and there's no way you can turn the products to form back the reactants again, call that irreversible process. That journey may be irreversible. That first take of that tablet, of that capsule, of sniffing of that thing may be a journey of no return. Some are fortunate to escape it, but you don't know what your case may be. So this is a clarion call. Please and please avoid substance use under any guise. Maybe you are facing some challenges and because of that you are having sleepless nights and you are told, please take this thing, it will help you to sleep well. It's not a laughing matter. I'm sorry for chuckling. But it's just that that sleep, you say you want to sleep, may now become addictive. You know, unless you take that thing, you see that your eyes will just open like this. And when you cannot sleep, that means your nervous system is not resting. What happens? There can be nervous breakdown. So to prevent nervous breakdown, you'll be having throbbing headache. You'll be hungry. A lot of things. Like one man sang fella, oríṣiríṣi ló máa ṣẹlẹ̀ sí ẹ. Different will be happening in your body system because of that substance you use. So unless you take that substance again, your nervous system will not be addressed of what use. But if you have that challenge, go to any reasonable, good, legal, registered hospital, government hospital, private hospital, seek to see the doctor. Then the doctor will be able to do a prescription for you depending on your chemistry, body chemistry, because the medical doctor will ask you some questions. Even the pharmacist are trained to be able to ask you some vital questions to be able to know the dosage to use, when, and they will even give you small to go and try, maybe for 1 week or for some days. They want to see how your body system reacts and works with the medication. In that case, your system will still be safe because you are under monitoring by the professional trained to do the job of saving life, which include yours. That it may be restlessness you have because of one pressure or the other. Like I read one story just this afternoon. Okay, I listened to it on YouTube. That young military officer was posted abroad, and he had been going. He had been married for more than 10 years now. And the wife had been complaining that I don't like to be left alone when all this time you keep traveling. The man said, I am a military officer, and my job is to save life, to protect people. I'm on assignment. So he was to go for this 6 months assignment. He went. I think about 2 weeks into the assignment, he just got an email from his wife, divorce letter. He said he just breathed it in because he had been trained to learn to take life easy, not to rush to make any judgment. And because of that military training and training given to him by his father, he mentioned that he was able to navigate. So you may be facing one pressure like that, or one sudden unpleasant news. Then your friends or colleagues or some just suggest, can you please take this? That it will help you to forget. Then you take it, it will help you to hallucinate. You be on cloud 9 or cloud 10. Actually, you take it, you will not be yourself. You even see sound will be forming structures, you'll be hallucinating. The walls will be crawling. The ground will be moving like snake or dragon. You feel cool and feel on top of the world. But that's the beginning of the journey almost to nowhere. The effects we wear off the world then. But if you are, that's why they have medical officer and specialists to take care of the military. They have PTSD, post-traumatic disease disorders like that. They have different. So when you have any challenge, go to them, explain to them. They'll be able to know. They do psychotherapy, a lot of other processes to try to take care of the mind. because the main thing is the mind. And if there is need for medication, they now give medication prescribed delicately because they know the effect if these things are abused. In case of serious pain, maybe fracture or something like that, there are some medication they give them. You don't just go and say you want to buy this one, buy this one, buy this one. Like tramadol is a prescription drug, which taking the right amount will take care. I was once given medication that contains high amount of tramadol when I had some medical challenge in the hospital. They didn't have any side effect on me because under strict prescription by the doctor and to use the right dosage, which I followed to the letter. And I didn't feel any isolation, nothing with my physiology or psychology, everything went well. Because first, when I saw that the thing contains tramadol, I was saying, which one is this? But because it was under strict prescription, it worked well. So I can categorically state that whatever challenge you may have, it may be psychological, physiological, which as I said, when I had that, I think it was serious infection that caused so much swelling, they call it one kind medical name, serious pain. I got to the general hospital and the doctor prescribed it to help to take care of the pain. So that is physiological. Psychological is that one of the military officers that I mentioned for you. Something that affects the mind. It may be bad news or whatever. Everything can be taken care of by the medical and the psychotherapy process. So you don't need to go for any medication or substance use by yourself under any guide. Not even from a friend. Is the person trained in that line? So this is a clear run call. We give more details in more reflections later. Ready just to let you know. Substance use. I call it substance. Note that I deliberately didn't use the word drug. It's substance because it goes beyond manufactured drugs. You see this in your neighborhood. Let your children know. Don't even smell it. Don't even do what? I did biochemistry. I know what it means to smell something. Like there are some chemicals that if you smell, the small one that enters your nose can do a lot of damage. Like I had in the chemistry lab, a student saw a container, the 5-liter keg. The liquid was like water, but it was ammonia. So young, without my knowledge, I don't know whether he or she many years back opened it and tried to smell it. Because in chemistry you say you can identify some toxins by smell, but you must get instruction from, excuse me sir, excuse me ma, this thing, what is it, can I? That's how the student just sniffed the thing. If you know ammonia, it's that very pungent smell, serious one. By then just no, God, thank God it didn't do too much dose. Coughing, the eyes started to watering. We are not crying, because the thing are gone to the system. So it needs add a lot of water to wash the face, to rinse the nose, to douse the hair, to be able to put it in. Because ammonia is very soluble in water. So put water in the nose like the bend down your head and put water and do all those to try to reduce the effect. So don't just smell anything. You say you come and smell this thing. It can be the last thing you ever smell. Like chloroform. That's why if you watch some films, you can see that they put chloroform. Those people, that's when they do kidnap, they put on person nose. That is smell gas. So nobody can just say, okay, this one say you're having a headache at bikini. Okay, sorry. This okay. Just bring that small bottle and say, okay, oh yeah. Try, close your eyes, breathe out. When I put it to your nose, just breathe in, take a deep breath. you now take a deep breath. Don't ever, ever, no matter who the person, don't ever, ever. It may be the last thing you ever did with your senses intact. So thank you for your time. Thank you for listening. If you've not subscribed to my channel, subscribe and let's reflect more. So I will still do more on this because by God's grace, I studied biochemistry. So I know the effect of this on our body, and it's one of the major causes we did. And by God's grace, I also work with an NGO that deals with prevention of substance use in our society and community and the dangers this thing can cause to our society at large. Subscribe, share your comments.